My son Eli suffers from chronic ear infections. He has had 5 ear infections back to back since November. And he has been on antibiotics for every single ear infection that he has had. We usually have about, I'd say, 2 to 3 weeks in between before the next ear infection comes. He's not really that cranky when he has them. The only thing that's really affected is the side effects to the antibiotics, and then he wakes up a lot during the evening. And we came to MUSC because of a coworker of mine recommended Dr. David White, who he said was a great pediatric ENT. So we made the appointment to go see him, and we told Dr. David White how many ear infections Eli has had, and he said that Eli definitely was a candidate for ear tubes. Oh, another thing that we talked about with him was he had a hearing test, and there was a little bit of hearing loss, not a significant amount, but there was a little delay in some of the sounds that he wasn't listening to. And he said that might have been because he did have fluid in his ears at the time. So we will have the surgery next week, and then 4 weeks after surgery, I believe he said that we would go back and have a hearing test. And I hope that by having the surgery, his hearing will be perfectly fine after that.
Can I take you around the corner and show you the tunnel? I'm not taking the surgery.
No, it's fine.
See how he separates.
And that will get him through the retro bulbar process, which nobody likes to be.
Doing okay? Anything changed since I saw you last?
We just had that 5th ear infection, like literally a week after we saw you. We was put on omnicef again, so we just finished it about a week and a half ago.
Okay, see you on any other medicines? Can you remind me how to work it?
Nope.
Eli's tubes went in fine, both ears. He had a little bit of fluid, particularly on the right side, that was kind of murky looking, and maybe an early infection starting there.
Yeah, like I said, this week his fingers were already back in his ears.
Yeah, so hopefully this will keep any further infections from coming. As we discussed before, you may see some drainage out of the ear tubes for the next few days. That would be normal. Sometimes it's a little bit bloody, so don't be alarmed by that.
Okay.
And the nurses will give you some drops, a little bottle of drops to use for the next 3 days, usually 3 to 5 drops into each ear 3 times a day for 3 days.
Okay.
And they'll write that down for you.
Okay.
There you go.
It might be a little bit gassy when he first wakes up. Has Elijah ever had surgery before? No. Probably not.
Did you
just went very smooth, kind of as we expected anyway, but a lot quicker than we thought too. So
Very much so. Went very fast.
very painless, and definitely would recommend it to anyone, you know, who's in question about it.
Right. And glad that we got it, considering he did have fluid already in his right ear again, which would have been the 6th ear infection. So.
All right, so it's been 2 weeks since Eli had his ear tube surgery, and so far we're very, very amazed and pleased with the results. Basically, we saw changes right away.
His
walk
he
improved,
walked a lot better.
a lot straighter.
No, he didn't stumble at all. Just a lot better sleeping through the night.
Yep, definitely slept through the night. He's sleeping through the night a lot better now. His ears aren't red anymore. He's not pulling on them. You just tell he's just not agitated like he was before.
Right.
So definitely a very good improvement on quality of life.
And I mean, it's been definitely the best decision that we made for him. Right, Eli? So today was our checkup with Dr. White. Yeah. And we saw the audiologist, Laura, and she did the hearing test first on him. And she said that his hearing improved over 100%, and that the ear tubes are doing what they're supposed to do. And we next saw Dr. White, and he was very pleased with Eli's progress, and said that he would see us again in 6 months, and if we had any problems during that time, to give him a call. And that he said, still expect that there would be drainage 2 to 3 times a year, and all we would have to do is just call him, and he would call us a prescription, and that should help with the drainage from the ear. But other than that, we were pleased, and so was Dr. White.